Alrighty. Thank you, Dr. Christopher, for joining me today and allowing me to interview you as a nursing leader. This recording will be available through the Graduate Nursing Student Academy platform for other graduate nursing students. So I
Wonderful.
just have a few questions to run by you today during the interview. The first one is, what is your title?
So I am an associate professor at Jacksonville University Craigman School of Nursing, and I also serve as the assistant director of DMP programs.
That is awesome. So please describe your nursing work and career, as well as taking us through a career trajectory as to what landed you in your current position.
Wow. So as I reflect, I've been a nurse for 27 years now.
Wow.
Yeah. And so interestingly, um, when I was made my decision or got called to nursing, I really didn't understand the difference between an associate degree program and a bachelor's degree program. I just wanted to be a nurse. So I'd actually applied to both. And at the time, I already had an associate's degree
Oh, okay.
in mathematics. So luckily for me, my associate degree packet, they misplaced it. And I got called for interview for the bachelor degree program, but I really didn't understand the difference. So I say I've been called on my trajectory, luckily in the right direction throughout. So if anybody's ever looking at this, sometimes we just follow that yellow brick road, right?
I
Um,
agree.
and so I, got my bachelor's degree. And during my education, I was just really passionate about moms and babies. So I knew early on I wanted to eventually end up in that specialty of nursing. But like we all do, started off in medical surgical nursing at a small hospital in Maryland. And what was great about that was I got to start off in med surg, but it was a float nurse position. So once I really got solid in the medical surgical units, they started letting me float to other specialties. So um, I was able to do psych and emergency, critical care, some peds, which I knew peds was not my area. As a mom, I just wanted to keep the peds at home, and I liked
Yes,
adults and babies. Um, but
understandable.
but for later in my career, that I'll share, that really gave me a solid foundation of all these different specialties across the continuum of care that I might not have really been exposed to, in a student
Mhm.
role or otherwise. So eventually, I got those years of experience and
Yes.
moved into a position in labor delivery where I worked a number of years. What I noticed during that time was I felt like I was capturing moms too late. By the time they got to me in labor
Mm.
delivery, I don't want to say the damage had been done, but I felt
Yes.
like I wanted to really work on the prevention side. So when we
Mhm.
moved back to Jacksonville, Florida, I moved into a position with Healthy Start, in which I was able to go out to homes, meet the moms in the clinics, and really work with them on social determinants of health, getting them into prenatal care, helping them resolve some of these issues, getting them into drug rehab, so that hopefully by the time they got to labor and delivery, and hopefully they made it to labor delivery, right, didn't
Yes.
have a
Mhm.
miscarriage or a fetal demise or what have you,
Yes.
that mom and baby would be in a much better position. And so then from that role, um, we found that a lot of the moms were coming through one of our local acute care women's center. It was like a women's pregnancy ER, if you will.
Okay.
So I took that Healthy Start program to to the hospital. It was one of the first pilots of this in the country,
Oh,
and got
wow.
started there, getting moms as they came through that emergency department. Sometimes in the first trimester, we were able to get them hooked up with Healthy Start prenatal care,
Mm.
and really help. So I worked for that for a number of years, and then decided I wanted to go back to school, get my master's, and be a family nurse practitioner, which I did. Um,
Mhm.
did family nurse practitioner stuff out in the community. I left the hospital. And then my CNO at the time, she called and she said, I want to go for this thing called Magnet. And I had no idea, but she goes, would you consider coming back and helping me go for this in the hospital? I said, sure. Because at the time, I'll tell you, the clinic I worked at, one thing to consider in grad school, you know, I was a single mom at the time, and I had Monday through Friday hours. I was usually at the clinic by 6 doing labs, and sometimes I didn't leave till 9 o'clock at night, and then I had call on the weekends.
Wow.
I don't remember much about my kids those 2 or 3 years. And I said,
That's
you
the
know,
long hours.
yeah. So she bumped my pay above that and gave me Monday through Friday hours. And for me, work-life balance at the time, that was important, having being a single
Yes.
mom. So I went back and helped the organization go for Magnet twice, for the Magnet designation. And, you know, we all figured it out as we went along. So I found during this journey, I really like projects and improving things and
Mm-hmm.
such. Um, so then once we had received our Magnet designation, there was change in leadership, change in hospital priorities. And one of those priorities was going from all paper to all electronic and going live with Epic. And this was during the big EHR type
Mm-hmm.
go live. And so I was called again. We would like to go all electronic and we need informatics nurses. Well, back in those days, there was very few, I think there might have been 5 or 6 master's level program and maybe 1 or 2 PhD programs that offered informatics degrees in person. Um,
Okay.
and so the federal government, part of the Obamacare legislation, was funding for nurses and doctors and pharmacists to get board certified. They created a board certification and a 6-month program. So I started up that department, and myself and
Wow.
those team of nurses, we went through that certification program and, you know, took the hospital live. So I call the informatics the gift that just kept on giving, because I never was really looking for that. It just kept
Mm-hmm.
finding me. And so
Wow.
I did that a number of years, and then decided to go back for my doctorate of education. At the time, I think the DMP programs were newer, and I knew I wanted to focus on education. There wasn't at the time a doctorate of nursing education. There's a few of those out there
Mm.
now.
Okay.
So I wanted to learn the art of teaching. And so I went through the EDD program. And so then eventually I started off as an adjunct professor to learn how to teach, you know, at a
Mm.
small scale, and then
Yeah.
eventually moved full time into teaching, because I just really uh, just really love that. And so the joke about the informatics piece is that was what they were most interested in, was me bringing those informatics skills and helping them launch an informatics master's
Mhm.
graduate program
Yeah.
for that. So I helped. So I came over to Jacksonville University and helped with nursing, and then also we had a Master's of Health Science in informatics as well. So
Oh,
um,
wow.
help them with that program and such. So that's now over with Dr. Perdelli, but I think JU has leveraged my expertise in 20 something years of doing projects in leading the doctorate of nursing practice
Yes,
program,
for
right? Because
that.
that's
Yes.
what we do. So sometimes I recommend to all of you just to be open to where you might get called, and really allowing yourself to leverage what you're really good at,
Okay.
because that you pay it forward to other nurses by sharing those skills and expertise in the next generation of nurses and nurse leaders.
I agree. That is amazing, Dr. Christopher. I
Yeah.
mean, you're like the jack of all trades. I mean, you have it all. And that's why
Well,
you're such a great professor. I mean, I just really enjoy
and
having
that
you
was being
there.
open to taking a med surg slash float job. That wasn't
Yes.
initially what I wanted to, but I said, hey, it doesn't
Mhm.
hurt to learn lots of different specialties and see where things shake out. So you just have to be
I
open
agree.
sometimes to what's presented to you, you know.
I agree. That is awesome. The next question that I have for you is how can we create a more inclusive and equitable work environment for all nurses in Jacksonville, regardless of background or experience?
That so that is something specifically that over my career I noticed that changed.
Mhm.
And what I mean by that is when I started off as a new nurse 20 something years ago, I remember um, the hazing experience.
Mhm.
And I tell you, these type of experiences could really be career ending.
Yeah.
So what had happened is I was a float nurse. Again, I was a relatively new nurse, maybe less than a year of experience being floated. And I came in
Wow.
on a day I wasn't supposed to be working to help. And so the nurses assigned me to a patient, and they didn't tell me that his front of his face had blown off from smoking with oxygen. This was not included in a
Wow.
report. So they waited for me to walk into the room to get my assessment. They were at the nurses station waiting for me to come out laughing. They would set me up,
Wow.
try to set me up as part of the hazing and such. And so in our generation of nurses, I don't
Mhm.
know if hazing was just expected as part of culture. You had to suck it up,
Mhm.
what do you call it? What is that old saying they would say, nurses, the whole hazing and stuff. I can't
I've never
remember.
heard of the hazing before, so this is actually new to me.
Yeah, there's some kind of saying. I can't remember it, but it really
Mhm.
made me not want to take that phone call or we're desperate for the nurse, right? And
Mhm.
it really made me question, like, is this the right place for me? Is this the right career for me and stuff? But luckily, there were so many wonderful nurses that I learned that I don't want that to see that ever happen to anybody, right?
Somebody else. Yeah.
And so a lot of my career, especially in the work with Magnet and such, was really focused on nurse and work environment,
Mm.
burnout, making sure folks felt they had a good onboarding experience, making sure their needs were met, including like right now, a big need for maybe international nurses.
Versus.
How do we make a place that's warm and inviting and healthy?
Mhm.
What I did notice is as the newer generation of nurses, and I would say that was about maybe 10 years ago, they were really less tolerant of this kind of old guard hazing kind of mentality.
Yeah.
They were more likely to bring forward these concerns. So I think the
Mhm.
first step is really being brave enough to share that these things are happening. And as
Wonderful.
nurse leaders, really welcoming that feedback and really working to um, create an inclusive and a belonging kind of environment. And one unit at the hospital where I worked at that I studied, um, they had some of the highest nursing satisfaction scores. And I really wanted to find out what were they doing special up there, and they
Mhm.
said one of the strategies they did is one, their nurses interviewed all the folks that would be coming on their unit, right? It wasn't just the
Oh.
leadership, the nurses were involved, and they were more focused. And this was a surgical ICU, it's a very skilled nursing team. They were very much interested in how many times did the person smile during the interview. They
Wow.
said if the person's got a good, warm, belonging kind of personality, they could teach them all the ICU stuff, you know.
Yes.
Um,
Mhm.
that but if they were cold or distant or they weren't making good eye contact, they weren't smiling, they probably wouldn't be a good fit for them. They said that was the one change that they really did. They wanted to create a culture on their unit where folks felt safe and belong. They would get excellent training, but they wanted to create a family kind of environment.
That's
Um,
awesome.
so I don't know if that answered the question, but as a leader, that I know that was just so critically important to me that we were taking care of ourselves. And then the further that in my postdoctoral work, I was very blessed to get to do a postdoctoral fellowship with Dr. Jean Watson and really
Mm.
studying caring science. So I think caring science provides us the framework to not just apply this to patients, but to each other, right? How can we really care for each other? How can we respect differences, whatever those may be, gender, race, whatever experience? And I think oftentimes folks will think some of our new nurses don't have a lot of knowledge or what have you. However, many of our brand new nurses may be second degree folks. I've worked with several that have been in corporate America for like 30 years of corporate executive experience, but decided they wanted to be a nurse. They always wanted to. And so I think we need to value not just all those kind of demographics, but the person's lived experience, their work experience, their knowledge, there's so much diversity and we're all the better for it. So I think being open and creating space that we can really leverage that in each other is just very wonderful.
Yes, I agree. That's awesome. I'll have to look up that framework by Dr. Jean Watson, the caring
Yeah.
science.
Yep,
Yeah,
her 10 Caritas processes. And then AACN, they have a healthy work environment framework as well. And that was a roadmap that we used. A third I would recommend is Dr. Clark's work in civility. And so I think the Medical Surgical Nurses Association adopted that, but there's like a stop bullying type toolkit and such. But Dr. Clark's work around civility is a great roadmap again for academia and clinical practice on how do we create these belonging, caring environments. Because at the end of the day, I think that's what it goes back to. Folks get burned out. They don't want to be preceptors. They don't want to teach. They don't really, some nurses reported to me, they might be crying out in their car before they came into their shift. How are they going to be given of themselves to teach others and care for others? So it really comes back to we can't be inclusive of others if we can't accept ourselves and care for ourselves. So I think it starts with us. And as we love ourselves and take care of ourselves, we can create that space where we can love and care for others.
I agree. I feel like the advice that you've given so far leads us to our next question.
Okay.
If there's anything in additional that you would like to add, then you're more than welcome to. But my fourth question was, what advice do you have for the next generation of nursing leaders? I feel like you've already shared so many great tips as far as what we should implement moving forward. But if there's anything in additional that you would like to add, I would love to hear it.
For me, what was helpful, especially with the call to informatics, was thinking ahead, right? So for example, I was in Dubai, I would say pre-COVID at an artificial intelligence conference, right? Where they were presenting all the latest and greatest. So I think AI is going to really change what nursing practice looks like in the next 5 to 10 years. It's going to be dramatically different than what I'm teaching today, what we've lived. So I think making sure once you get out of school, whether that's your initial degree, your graduate degree, you got to keep learning because the world is and data and practice is going to be transforming so rapidly that if we're not keeping our finger on the pulse and learning these new technologies and how to really leverage them in practice, you're going to fall behind. And so like during that big period where we went from paper to electronic, we had a lot of nurses who couldn't adapt, nurse leaders who couldn't adapt, and they ended up retiring or leaving practice. So we don't want to lose great nursing expertise, right? But I do think that it's gonna look very different. And so I'm even thinking as a nurse educator, how do I get in front of this and train the nurse of the future, right? So I think all of us really having those conversations and keeping ourselves abreast of these changes and being knowledgeable as things are coming out. And that's where some of the newer generation, I think, can teach some of us leaders that have been maybe doing this for a minute, a few things, right? And so really leveraging their skill set and technology and how can we really make use of that and how can we ensure they're getting trained and bringing that back to our units and our departments and our programs so that nursing is well positioned for the future. But yeah, I just think that the competencies and such that we teach today, I really envision there's going to be a new skill set. It's going to be what I've noted in some of the research that we just completed across the country is with our industry partners, mostly hospital type nurse leaders, is the competencies they were really expecting of new nurses. So this would be a
Mhm.
new ADN or BSN nurse transitioning to practice, really sounded like MSN essential competencies, like the old MSN.
Wow.
So my question really is the MSN the new BSN?
Yeah.
Because they were really wanting to be able to come out of school and be ready to initiate QI kind of projects and have that kind
Mhm.
of skill set. And I was like, well, all these competencies they were naming off, I said that was the current or the old MSN essentials. A lot of it was the
Hmm.
informatics competencies. Um, so just by that, industry's already telling us the old BSN competencies weren't enough, right? And so now we've got
Mhm.
the two levels. So I'm wondering how much of the advanced level, which is really DMP level,
Yeah.
where's that middle, which is the MSN, right?
So, yeah.
Yeah, so it's there's going to be, yeah, it's going to be tough. And then then that begs the questions, is 4 years enough, for a new nurse? Is that enough? And then
Yeah.
the other problem with that is many of our new and this is entry level, um, don't have access to EHRs, right? They can observe with the nurses and
Mhm.
such, but they're not given full documentation, right?
Well,
So that could be a hindrance with them being practice ready when they come
I
out. So for graduate prepared
agree.
nurses, um, I think they have more access as far as like in the F&P role or some of those
Mhm.
roles.
Oh, no,
But
for
I don't know,
sure.
that can be a barrier as well. Um, if folks don't have access to the technology they need to prepare them for the role. So I think that's where we all have to really work together, academic clinical partners, ensuring we're
Mhm.
preparing our future workforce, our future nurse leaders.
I agree.
But
I agree.
yeah,
No, that is also, but no, I
and then
completely agree.
the other piece with that, and I bring that back to caring, is as we
Mhm.
get more technology, we've got to keep the caring at the center of everything we do.
Yes.
I think we can get pulled way into those computers too much and forget that human that's in the bed
Yes, I agree.
and each other,
Mhm.
right?
Yes, I
Yeah.
completely agree. Yes, that is true. It can be challenging, especially with the amount of information that's required to be charted. But I think
So
that we have to
much.
remember that, the focus is the patient. Everything else can be done after.
And that's where my hope is. My hope is that AI and such technology can help pull all this data from all these different things for the nurse to do their job more effectively and
Yes,
efficiently so we can spend more time at the bedside with the patient and the family and in our communities,
I
so
agree.
that you're not hunting for labs, but rather things are being packaged and pushed to you, so
Put
it
to
makes
you.
it much quicker,
Yeah.
to make all these connections or sepsis alerts or all these kind of things that I think AI could be like a personal assistant almost in our
System.
role.
Yes.
Same for nurse leaders. I think AI technology, as nurse leaders learn how to leverage that, can help with data analysis, trends, quality improvement, patient
I
safety.
agree.
There's so much utility. So it's teaching folks how to really leverage this tool to work smarter, not harder, so we can really
Yeah.
focus on our staff, focus on our patients, focus on each other. Get
Yes.
back to what I think the art and science of nursing really and the heart of nursing is really about.
I agree. I completely agree, Dr. Christopher. Well, thank you so much for your time, Dr. Christopher. This
You're
was a
welcome.
pleasure. I can't wait to share this recording with the other graduate students.
Well, thank you so much.
You're welcome.